Hello and welcome to the third annual Accelerating Innovation in Aging Demo Day. I am Stephen Collins, the CEO of Matter. At Matter, our mission is to accelerate the pace of change of healthcare. We run an incubator for healthcare startups. Since we launched in 2015, we've supported more than 1,000 companies from around the world that have raised more than $5 billion to fuel their growth. We run 6 or 7 startup accelerators every year, 3-month cohort-based programs that are developed in partnership with large health systems, life sciences companies, payers, associations, universities, and foundations, and that focus on particularly challenging and meaningful areas of healthcare. We work with large enterprises to help them build their innovation capabilities with a suite of education and training and insight services that help them make sense of emerging technologies and figure out how to harness them. And we are the digital health hub of BARDA, which is the arm of the Federal Department of Health and Human Services tasked with nurturing innovations to make the country more resilient and better prepared for future pandemics and other public health emergencies. The Accelerating Innovation in Aging program supports entrepreneurs building solutions to improve the care and quality of life of older adults. Both this year and last year, we focused on solutions to help people navigate caregiving and improve caregiver well-being. The 7 companies you'll hear from today participated in a 4-week innovation sprint that included mentorship, an interactive curriculum, and additional resources to help them further develop their solutions. Each of the companies also received a 6-month membership to Matter, so we can provide ongoing support into 2025. This year's program has been supported by 3 wonderful foundations. The RRF Foundation for Aging has been our partner since we started this initiative in 2022. The foundation's mission is to improve the quality of life for older people, and they are one of the first private foundations devoted exclusively to aging and retirement issues. I want to give a very special thanks to Mary O'Donnell and Amy Eisenstein, as well as the board of RRF Foundation for Aging, including Tom Kuzmarski and Dr. Anthony Perry, for being great partners supporting our work. This year, we also had the good fortune to be able to collaborate with the Samuels Foundation, which works to improve the healthcare and overall quality of life for New York City's older adults, and Next 50, a private national foundation based in Denver that works to create a world that values aging. Thank you to Lauren Weisenfeld and Sydney Beyer for all of your support. Earlier this week, each of the startups you'll see today shared an extended presentation to a panel of judges, including Jenny Poth, who leads venture capital investing for Ziegler, Steve Ewell, who runs the Consumer Technology Association's foundation, and Stephen Liu, who runs A2 Collective, and who, by the way, opened applications this week for the A2 Pilot Awards, offering non-dilutive funding opportunities for innovators. You can learn more about that at a2collective.ai. In addition, the leadership of the foundations I mentioned all helped earlier this week with the judging. Thank you to all of the judges for your participation and your insights. We will announce the winner of this program following their presentations, and the winner will receive a check for $10,000. Before we hear from the companies, I am very pleased to welcome 3 leaders in improving the lives of older adults who are going to share some insights with us. Osvaldo Montalongo is the founder and CEO of Connect Care Hero and the 2022 winner of the Accelerating Innovation and Aging program. Carrie Zwiebel-Blas is the executive director of Heights and Hills, an organization that supports older adults and caregivers in Brooklyn. And Abby Weiss is a social worker with Weill Cornell Medicine who focuses on connecting older adults and their caregivers with resources and support. Thanks to each of you for joining us, and let's get started. So, Osvaldo, I will start with you. Brief introduction of yourself, your organization, and your relationship with family caregiving.
Yeah, no, hey, Stephen. Yeah, everyone, hi. I'm Osvaldo Montalongo, the founder of Connect Care Hero. And we're tackling social isolation for our healthcare partners and family caregivers by providing them with Netflix-like software. My connection to caregiving is with my dad. He had me at 57, famous from Mexico, and I just found myself in a place where there's not enough cultural curation for how they were engaging with my dad, and which led him to fall into deeper isolation. And so we created Connect Here to help address that.
Thanks. Carrie, we'll go to you next, and then Abby. Same question.
This is Carrie Bloss with Heights and Hills. We are, oh, here we go, start my video. We are, as you said, a Brooklyn-based organization that supports older adults in our community as well as family caregivers. I became a caregiver during the pandemic. My stepfather, who raised me, had terminal cancer, and my mother was caring for him. And then all of a sudden she needed a hip replacement, and we were working remotely, two kids going to school remotely. No one was vaccinated. It was very scary, and I was exhausted. I was going there every day or every other day. And a friend of mine finally said to me, "You're a caregiver, you need to call Heights and Hills for support." I had no idea I was a caregiver, and I had no idea that I could get support. So it is, among other aspects of my work, a real mission of mine to make sure people understand what it means to be a caregiver.
Thank you. And we're going to talk more about that exact topic. Abby.
Hi, I'm a social worker at Weill Cornell Medicine in Manhattan. I support two neurology programs, one for movement disorders and one for memory disorders, so primarily Parkinson's and Alzheimer's. And I see both patients and caregivers in this role. In my personal life, I have been providing care for my 83-year-old father who moved in with me about 6 years ago. He has several chronic conditions and which have led to multiple hospitalizations through the years. And, it's been interesting to be both a consumer and a professional in this space. So I think that's helped on both ends.
Yeah, I maybe have some of the experience I do sometimes where on an intellectual level, some of these healthcare challenges are so fascinating, but then on a human dimension, you sort of put aside the challenges that are involved from a human dimension. But Carrie, I want to come back to you and then the thing that you said and which you've talked about previously. I know it's come out through your time both personally, but also in your work focusing on caregiving, and that it's a real challenge getting caregivers to recognize that they are caregivers. And that's an unusual challenge in a lot of cases when you're trying to provide services and support for them, because if people don't recognize that they are a certain thing, it's hard to reach them and hard to provide them with resources and support. So can you talk about that as a as a societal challenge and how it is that you're working to address it?
Absolutely. Yeah. Being as someone in middle age, I feel like every time I catch up with a friend, they, how are your folks? And all of a sudden they're telling me about their challenge in caregiving. And I say, you could get help as a caregiver. And they're like, I'm not a caregiver. And it just, so some of it for me is just talking about it all the time, constantly. And then I find that friends who are deeper into caregiving will say, oh, learn how to be a caregiver before you're a caregiver, get help before you need it. And so we, thanks to the Fan Fox and Leslie R. Samuels Foundation, we're able to fund an outreach worker who spends she's a MSW level social worker. She spends all of her time connecting with organizations in the community to help get out the message about caregiving. And we have just like a two-sided postcard that has 4 checkboxes on it. Do you coordinate medical care? Do you help with household maintenance or meal prep? Do you assist with bill paying or other financial matters? Do you provide transportation? Those are things that people don't think about. Obviously, when you're going to, when you're like deep in it and you're, you know, putting out meds every day and going to, you know, coordinating all of that. But in the earlier phases of caregiving, you also often don't realize, oh, well, I'm just grocery shopping for mom. It's not a big deal. I go grocery shopping for myself and I pick up food for her. And getting people to see like, yes, you are just doing that, but that's still caregiving. And it will soon, it could, and it will likely at some point become more than that. And the more you understand about what it means to be a caregiver and the kind of support you can get, the sooner you know that, the more you can prepare for as it gets harder.
Yeah, I want to come back to that, but Osvaldo, I'll turn to you for a minute. And you know, one of the things that I know you're very passionate about is putting messages into a context that people will understand. It's relating to people from different cultures at their particular sort of in their cultural kind of language and dimension. What are some of the challenges that you've seen, and how do you work to address those needs, obviously as relates to caregiving? Aldo, we're not able to hear you.
There we go. Yeah, no. I'm a big believer, obviously, in cultural messaging. Has a huge impact in whether someone chooses to engage or not engage with their health. I think that there are, you know, specific cases where, you know, that's super important because it comes to their health and overall well-being. And so at Connect Your Hero, we're trying to do that very intentionally. My personal experience as a caregiver was with my dad. Moved him into a nursing home up until until 2018, when he passed. But up until then, I did, you know, really see an issue with staff members not really engaging with someone that didn't speak English. And with my dad, because he was, you know, from Mexico. They really didn't know what to talk to him about. And it wasn't until I finally told him, hey, like, if you talk to my dad about these 5 subjects, mariachi music, the farm, you know, XYZ, he really would come back and kind of, you know, even though he had dementia, would come back for a while and actually engage with you and actually pay attention and be more compliant to whatever you're asking him. And so, you know, I see this approach being a more something that's growing within the space where, you know, having cultural inclusivity when it comes to programming and solutions that are doing that will play a big factor in how you engage, especially some of our most, you know, at-risk populations, especially, you know, at the end of the day, when you do that, you can actually help alleviate some of that family caregiving needs as well. But yeah, it's a space that, you know, we're super passionate about and can talk for hours. So
I wish we did have hours because I could ask you 100 different questions. But Abby, I want to turn to you and actually go back to something that related to what Carrie was talking about that you've mentioned, that that people are often surprised when things happen that result in them requiring caregiving support, and that similarly family caregivers find themselves surprised to be in that role that they're playing. And in fact, it really shouldn't be a surprise given that most of us are going to get older and require more support as we reach certain stage of life. So how have you been able to work to help to normalize this phase of life so that people aren't kind of caught behind the 8 ball, as they say?
Yeah. Yeah. So, you know, I think it was Rosalind Carter who said, you know, there are 4 kinds of people: people who have been caregivers, people who are currently caregivers, people who will be caregivers, or people who are receiving care, right? So we're all going to need it. We're all going to give it. It's a universal truth. And, you know, people are living longer with chronic disease. So, and yet I am, in the time I've been doing this work, always surprised at how people just say, I never thought it would be this way. So, you know, I mean, echoing what Carrie said, you know, first and foremost, providing just that education to people, you know, you are a caregiver, you know, this is what it is. And but you know, I just try to normalize that it's not, you know, if, it's when, right? Just to normalize that conversation. And you know, I think people really underestimate the, you know, both the practical and the emotional demands of caregiving. So By the time I see people in my clinics, there's usually a very serious, pretty grim diagnosis. But, ideally, yeah, we just want we want to normalize this. We are all aging. We will need care. We will need to provide care. And what does that look like? So that's kind of how I always try to, hope for the best, plan for the rest, because it's going to happen. So.
Carrie, the population in the United States is aging, and the estimate is that the number of people who are over 80 in the United States will more than double over the next 25 years. That will continue to obviously increase pressure on our healthcare system, but our whole society, even outside of healthcare, is not really organized around the needs of older adults. It never really has been. So what do you see as the future of caregiving? How do you think that caregiving needs and support systems will evolve in the coming decades?
Yeah, I mean, part of the reason for that huge growth is the baby boomers. As of December 31st, every baby boomer will be 60 and older. And, as Abby said, people are living longer with more chronic conditions. So that is the cause of that anticipated growth. Just a few years ago, AARP did a study that the average caregiver spends $7,000 a year on caregiving. That's not lost wages, so don't even count that, but just buying things that someone they're caring for needs. We know that everything's becoming more expensive. That study, I think, was 2021. So we're certainly going to need more money for caregiving. Right now, we provide basic supplies. So if somebody is having a food emergency, if someone can't get incontinence supplies, they need an air conditioner, those kinds of things, we'll provide that. But we have pretty limited funding to do that with. And so I think we're going to need to see more of that, because people are going to start facing, and they already do, but it's going to get worse, that they're going to have to make the choice. Am I paying my rent? Am I helping mom and dad buy groceries? Am I paying for childcare? Am I paying for that medication that they need to stay alive? And so it's going to become financially ever more burdensome on families. And I think we're going to have to see a change, or there's going to be a real crisis.
What kind of support and resources do you think are essential for caregivers, and how can communities or governments or organizations, others, work to improve access to these kinds of resources?
Sorry, that was still for me?
That's for Abby. Sorry.
Oh, sorry.
Sorry about that. Yeah, I mean, as far as resources go, across the United States, there are area agencies on aging, right? And this is a fantastic resource that I think so many people don't know about, where there is case management, caregiver support. It's free, it's great. That I am constantly referring people to those resources. And disease-specific organizations offer a lot of support. There are amazing podcasts out there. There's great websites, Conversation Project, Prepare for Your Care. I just think and I think it was Carrie who said it, or somebody said it, because of the sort of ageist culture we have lived in, things are not targeted to older adults. Technology is not targeted to older adults and caregivers the way it should be. I mean, this is a really untapped group that so much, and which is, I know why we're here today, but I'd like to see more done to, people are like, oh, old people can't use technology, or they don't care about technology. Well, that's just not true. And I think it's actually, a gold mine if that's you tap into it the right way. But, from my perspective, I'm just trying to, I think, Hospital discharge planners need to get people better resources. They're always setting them up with home care, but they're not really setting them up with what I think are the important resources. Connecting them with a good caregiver social worker, that would be a great start. So that's what I think.
Thank you.
Yeah.
All right, Osvaldo, if you could wave a magic wand, change one thing or deploy one innovative solution that would improve the world of family caregiving and the lives of both the caregivers and the people receiving care, what would it be?
Wow, get the magic wand. I think when I think about this, I think of like how do we empower our current healthcare frontlines team people out there, but also like how do we take some of the pressure off of our current systems. So I would do a two-pronged approach from my lens. Kind of, we're building this like Netflix of healthcare. I would kind of, lean into that because a lot of people are aging at home. So how do we, provide some type of software solution that can, provide culturally inclusive programming, to family caregivers and the aging adult. Make it a one-stop shop though, where you could not only have programming that's culturally curated, grab that attention, and then from there deliver the health messaging at the right times, but also be able to do your doctor visit, right? E-visit. And then from the other side would be how do we activate more places like adult day centers, right? We have the baby day centers, baby daycare centers right now, but like on the other spectrum, right, where this is a first stop where you can get a lot of resources, provide that respite care for family caregivers, before they really need to go to more serious care. So those would be my kind of magic wand moments that I would do.
Yeah, I appreciate that. One of my other takeaways from this conversation is that we ought to have some sort of a large-scale public service campaign, public service announcements about what it means to be a caregiver and how you can get resources and getting people to identify that they are actually caregivers. I realize it's a short conversation, but we want to get to the presentations. Thank you to each of you for your insights and your comments. I always really like talking to people who are passionate about what they're doing, and specifically in the area of ways to improve health and healthcare. So thank you for your time. Thank you for your participation and your insights. I'd now like to welcome my colleague, Katie Costco, who leads the Accelerating Innovation in Aging program. She will MC the startup presentations. And Katie, take it away.
Thank you, Stephen. And hi, everybody. My name is Katie Costco. I am the Partnerships Manager at Matter. And so as Stephen mentioned, I will moderate the program and do my best to make sure that everybody stays on time. So each startup will have 5 minutes to pitch, and then afterwards we will announce the winner. And then also please join us for the virtual networking session after the pitches. The networking session will take place on a separate Zoom. We will share that in the Zoom chat, and it has also been shared with you on email. So with that said, I'd like to welcome the first startup presentation, Patrice Martin, CEO of the Sandwich Club.
Thank you, Katie. It is such a pleasure to be here. I'm Patrice Martin, the CEO and co-founder of the Sandwich Club. We're the go-to destination for caregivers' questions big and small. Think of us as the nerd wallet for caregiving. The Sandwich Club is a venture from the Holding Co., a design lab I co-founded focused on the care economy, which has given us a really unique position to design with and build with some of the most innovative companies in care, as well as learn from and design from over 2,500 caregivers to date. So we have the ability to really intimately know their experience. And I can tell you in my over 20 plus years of working in innovation, this is a deeply, deeply underserved group. So again, think of us as the nerd wallet for caregiving. And I was talking about how we've designed so deeply with caregivers. And there are so many caregivers, 130 million in the US, and they lack time, they lack support, they lack information. All caregivers are squeezed. But the sandwich generation, those taking care of kids and older adults at the same time, are particularly squeezed. So there's care work is like, on average, caregivers are doing 26 hours a week of taking care of others. And here's what that work looks like broken down. So they're doing the care. This is the human intensive work that we, it's the work that is really the essence of care that we want to be so protective of. It's also coordinating the care, the complex logistical work of making this happen. But it's also knowing how to care. And this is where we see the greenfield opportunity for the Sandwich Club. This is, how do I actually take all this responsibility and know what to do, how to make a plan this day, this month, this over the next couple of years. Take, for instance, like, what do I do with my dad who's having outbursts at dinner with his dementia, or help mom navigate Medicare, or even understand what to do with my 6th grader who's being bullied. These are high stakes issues, and caregivers are so often alone in figuring them out. And until the advent of technology, we haven't been able to handle the personalization of these issues. And this is where the Sandwich Club really sits. So we're creating a modern digital membership that gives caregivers instant access to all of this information so they can make decisions with confidence. So here's how it works. A member puts in a question: how can we get care for a father with dementia without depleting his savings? The Sandwich Club AI instantly responds. No question goes unanswered. We also share curated resources with caregivers, and then essentially, like, other Sandwich Club members chime in with their tips, their experience, what's happened for them, which is information that's so critical to caregivers. So you may be wondering, how is this different than ChatGPT, than Google? In a couple of very critical ways. Number one, it's about integrating lived experience. So what if people who have been in my shoes, what did they do in this situation? So we know caregivers triangulate information. We're putting that triangulation all in one place. So we're bringing together curated resources, we're bringing the AI response and the lived experience of others. We can also be proactive in getting out in front of what caregivers want to know next by understanding their patterns. And it's a place that is especially for caregivers, so they can trust it, they can let their guard down, and they can come back again and again. So we're building the one-stop go-to destination for caregivers across the full spectrum of their caregiver needs. Today, it's very much the Q&A experience that I just showed. We have over 1,000 questions on the platform and 500 users. We're quickly moving into building out a dynamic platform of calculators, tools, resources, and guides for caregivers, and then opening up a marketplace so that not only can caregivers find the information that they need, but also the products and services that make their lives easier. So why the Sandwich Club today? Why now? We're at a moment in time in which we are seeing organizations want to support caregivers and innovators building to serve caregivers in a way that just did not exist 6 years ago. So the Sandwich Club is a natural extension as a benefit to healthcare, to employers, to insurance providers. We also want to monetize and turn on this marketplace so that we can get caregivers the exciting breadth of solutions that are now available to help them save time, save money, do their work better. And we are the people to be able to do it because we so deeply understand this group and know how to create an experience that they will return to time and time again. So that's the Sandwich Club. We are so excited to be bringing together caregivers so that they can get the support and respect they deserve. Get in touch with us for all the things. If you know caregiver communities that the Sandwich Club, we could bring the Sandwich Club to, please let us know. We're looking for strategic partnerships. We're looking to turn on our marketplace and more. So thank you very much.
Thank you, Patrice. Next up, we have Kwame Liddell, founder and CEO of ThriveLink.
Hi, my name is Kwame Liddell, and I'm the founder and CEO of ThriveLink, where we talk to families, that we build bots that talk to families and enroll them directly into social programs like food stamps, utility assistance, and health insurance. They now even help families schedule rides and access very other clinical programs. And we built this because I'm an emergency department nurse, and I cared for so many families that didn't need more healthcare. They needed to be able to afford their medication, access stable housing in the older adult context, remodify their homes, and all these things that had where the healthcare that we were providing was just a symptom of what was happening in the world. And we started out as volunteer nurses that would just fill out applications for things and give it to families. But we quickly learned that 54% of all adults have reading barriers that prevent them from being able to do that. And it's extraordinarily important for older adults because 42% of all older adults live within 200% of the poverty level, which means that they qualify for what AARP describes as billions of dollars in everyday resources. But because them and their caregivers struggle to read and understand how to navigate the insurmountable administrative barriers, they're not able to actually receive these resources. The time is now for us, where we partner with hospitals and clinics and organizations across the country to help them, as all hospitals and clinics are now required to do what are called social drivers of health screenings, which means they're required to ask families, do you need help with food or housing and things like that? And they're required to help them. There are 1 billion screenings per year. We completely changed the experience. Typically, you have to send a referral to somewhere or ask them to go do something else. But now, this is a real example at Atrium Health in North Carolina, where the doctor is simply able to give the patient a phone number. Our bots answer the phone. There's no reading, smartphone, or internet required. And it helped them, in this case, sign them up for the local utility assistance program. They sent us this screenshot where it paid their $519 utility bill. There was no work for the doctor. There was no cost for this. The health system didn't have to pay for this this support that they received. And we began to do this at scale. Here's a real example, because typically when we talk about this, people think, oh, that's helping the patient, but not the caregiver. But here's a real example where they're the same. At Boston Medical Center, here's a real patient where mom wasn't enrolled in Social Security benefits. And that's interesting because when you pay into Social Security, but you still have to do a very long application to actually receive those resources. She received all these things that are valued at $14,200, but her daughter also began to be paid for the caregiving that she was already providing. And the state of Massachusetts had been supporting her mom for years and hadn't accessed this resource. And all she had to do was talk to our platform to be able to access it. It's extremely easy, no reading, no smartphone, no internet. It works in 75 languages and is available 24/7. It's very simple. Families just vocalize their answers. It completes the application, sends it to the government, and then our partners get very impactful data. It's very simple handoff. That's why it works in clinical settings. They simply give them a phone number and they call it, and it makes it easy. Here's a real impact. At Atrium, 28 patients used it. They received $20,859 in resources. In Boston, this was specifically for families over 70 years old. Said there was 76% engagement rate, which means that when they offered it to they offered it to 55 families and 76% of them used it. When you compare us to solutions on the market, we're the only one that you don't have to download an app and be able to read and do all these things, where you can just talk and access all these resources. We launched ThriveLink live to market outside of our MVP in January. We've already generated over $400,000. And our value proposition is very easy for hospitals and clinics. Staffing ROI, we've done studies that we average 400% ROI. It's revenue generating in Medicare. So even if a family needs help with this, the actual caregiver who bought our app actually generates revenue, and it meets very important regulatory requirements. We're asking for more pilots and partners at hospitals, clinics, community orgs, and governments. Just this year alone, we completed over $1 million in applications, served over 1,000 families, and saved over 1,000 hours. Thank you.
Thanks, Kwame. Next up, we have Shivi Singh, founder of Legacy.
Hi, everybody. My name is Shivi, and I'm the founder of Legacy. We enable health systems to provide beneficial end-of-life care to their patients. Meet Sarah. She is a 76-year-old patient who was diagnosed with metastatic breast cancer. She knows exactly the type of care that she wants moving forward. She wants to be at home, in comfort care, surrounded by her loved ones. But unfortunately, no one on her clinical care team knows this. And so what's going to happen is that her oncologists, her nurses, every single touch point in the clinical sphere is going to go in and find any possible option to get Sarah a better clinical outcome. But again, that's not what Sarah wants. And she's going to be stuck getting intervention after intervention that she neither wants nor is actually leaving her in a beneficial situation. And this is the reality for millions of patients today. And it's all due to the misalignment between what a patient actually wants and what their preferences are, and the clinical care team actually getting to know those preferences. This misalignment actually results in an enormous amount of spend on unproductive care, $700 billion every single year. This is 1/5 of every single medical spend in the US alone. And this is the biggest problem in healthcare today. It's so big, in fact, that there is a process called advanced care planning that was created specifically to fight this type of non-beneficial or unproductive care. The idea is that we can actually give patients the care that they want by simply listening to what they want. And this process is legally recognized, it's medically reimbursable, and it is proven time and time again to actually make a difference in the quality of care that a patient receives. However, this process is not working as it should. That's because doctors do not have the time, clinicians do not feel they have the training, and the data that we learn about a patient is fragmented and inaccessible within the EMR system. That's where Legacy comes in. We're an AI-powered platform that actually integrates to every single touch point between the clinician and the patient, whether that's telehealth or on top of the ambient AIs. We take the information and run our machine learning models to actually understand who the patient is, what their preferences are, their preferences for quality of life, their even medical adherence rates. And we take that data and give it to our clinicians to actually coach them to have better conversations with our patients and to build more adherent and goal concordant care plans. Lastly, we use our machine learning models to actually create medically accurate and billable notes specific for the advanced care planning conversations. We make these ACP workflows super simple and actually native to the whole patient journey and the clinical care team's process as well. We're integrated within the EMR. We train and upskill the existing workforce so that non-physician clinicians can actually have these conversations in a way that's reimbursable. We create the medically accurate and AI-generated notes, and we create reports about the patients that are easily accessible within the EMR and integrated so that anybody on the clinical side can learn about that patient in less than 20 seconds. We actually own the whole horizontal, from identifying the patients who need ACP and whose preferences we need to know, to actually guiding our clinicians to have deep conversations that are personalized for that patient, and then getting the right data and reports so that we can continue to always understand the patient and have it up to date with every single touch point that that patient has with the health system. In this way, we enable providers to deliver high quality, cost-effective care every single time. This is important more than ever before because health systems are increasingly paid based off of their quality of patient outcomes, which means that when advanced care planning isn't done and the type of care and patient outcomes isn't as good as it can be, it costs health systems their revenue and their reimbursements. This market is set to more than double in 8 years due to the aging population, the population getting sicker, and the shift to value-based care. That means Legacy's at the right place at the right time to not only help provide better care for our patients, but to also create cost savings, incremental revenue, and better patient outcomes for providers themselves. We are pre-launch and we already have LOIs and investment from health systems, as well as an active clinical integration that has led to a physician-backed case study. We are here and ready to help patients. And for us, this problem is personal. Every single person on our team has experienced what it means to have a loved one go through non-beneficial care. So we have the clinicians who know this process like the back of their hands. We have the folks on the commercial and billing side who understand the in and outs of health systems. And we have the right product and engineering folks who know how to build for various parties and leverage machine learning in the best and ethical way possible. So let's transform healthcare by putting patient values at the center and empowering our providers to follow them. Let's connect. We're looking for investment for our seed round and for connections to health systems and providers for early pilots to get this product going. Thank you.
Thanks, Shivi. Next up, we have Avonlea Christine, founder and CEO of Avonlea Care.
Hi, everybody. I am Avonlea. I'm the CEO and founder of Avonlea Care. And we are a healthcare technology company that is bridging the gap between health plans and caregiving families. So why did I do this? Why did we do this? Why is supporting caregivers in this country important? Recently, I read a World Economic Forum report on the care economy, and it said the care economy is one of humanity's most valuable assets. And the care economy is expected to surpass what the space economy is going to yield by 2035. So we have a massively growing aging population and millions of people who are here. You and I, if I could see your faces right now, I'd ask you to raise your hand to say who here is providing care for an aging parent. I bet a good number of us are. So, oh, I heard a pop. Somebody did raise their hand. So we, as a company, have the opportunity to help incentivize health plans to support caregivers. These two pictures here are important because to my left is our first investor, who now serves as our chairman, Esther Dyson, who took the first bet on this company and is really kind of a mother in internet who's been great in helping us build a product, bring it to market to help solve this problem. And to the right here is my grandmother and my mom and a Walmart delivery driver. This was the first picture taken when we integrated Walmart shopping into our platform to help people like my mom, who I built this for, so she no longer had to take time away from work to go pick up groceries. So more on that. So why are we supporting caregivers? We've broken it down to really three kind of aspects in our platform. Caregivers really don't have resources around what do I do next, caregiving tools, and then just wellness and self-care. When you become a family caregiver, it is a burden both emotionally, financially, but also can be physically. Most people, when thrown into this situation, don't actually know what to do. Who do I call? When does my mom need home health? What type of health plan should she have? And so we've built out a knowledge base to really support the caregiver at the core of this. So the problem that we've identified with Medicare Advantage plans that they face is just improving the challenge in improving health outcomes for members while also ensuring a strong financial performance. What's very interesting is roughly 37 million seniors rely on an informal caregiver. So that's you and I. And about 60% of informal caregivers are the key communicators with mom or dad's health plan, but they lack the proper channels in communication. So health plans miss about 107 billion a year in missed revenue due to simply the inability to communicate with their members. So what's the solution? How do we solve for this? I believe we're entering a time in this country where leveraging unpaid caregivers, both by health plans and governments, have taken notice of this, leveraging them into the healthcare system to help support people aging at home is going to solve this massive crisis that we're entering. So we help drive member retention, we help grow revenue, improve medication adherence, and optimize costs. So pulling up the hood, what does our platform do? Avonlea Care is the first SOC 2 compliant platform that we've launched into the Medicare Advantage space that has a full integration with Walmart grocery and delivery, OTC, health and wellness. We focus on prescription delivery, so making sure that caregivers and plans have the ability to order medications through our platform, supplemental benefits, appointment scheduling, gathering those wellness visits, breast cancer screenings, getting them into the platform so the caregivers and the plan have the ability to make sure mom is getting to them, and CAP surveys. So why is it important to have food available via a platform for seniors aging at home? We want to promote nutrition around chronic condition and optimize flex card usage. This is a very unique feature because if you are out of state, not in the same town as your mom, you have the ability to get her groceries available in all 50 states via this integration. Okay, so what's unique about Avonlea Care? What have we done that kind of sets us apart? We've spent the last 2 years really building a product that allows for health plans and caregivers to simplify everything into one comprehensive solution. And by doing that, it was important that we integrated pharmacy and grocery, cheaper medications into the platform so you can not use 5 different solutions, but just one. We do have a full pharmacy delivery separate of our integration and partnership with Cost Plus Drugs coming this quarter, and are in discussions with a very large retailer on vaccine scheduling through our platform. So results, better health outcomes and a better financial performance for health plans, while at the same time providing support for caregivers to engage and help seniors age at home. So thank you so much. We are looking for additional partners in Medicare Advantage, and we are raising capital, and you can contact me here below. Thanks.
Thank you, Avonlea. Next up, we have Julie Kennedy, CEO and co-founder of RubyWell.
Hey, everybody. Thanks so much for being here today. I'm excited to talk to you about RubyWell. At RubyWell, we are specifically focused on the middle-class population that is caring for a loved one at home and their family member is on traditional Medicare, growing into Medicare Advantage, but right now traditional Medicare. We're not focused. There's a lot of activity in the Medicaid eligible population. We're interested in this missing middle workforce that is essentially the backbone of home care for Medicare. It is an active strategy of the government to have active home care as a way to keep especially high cost, expensive chronic patients out of hospitals, out of the system. And yet these are people who are doing this, 40% of whom are leaving their jobs to provide this health care at home. We know that with a trained and paid family caregiver in the home, in fact, system utilization can decrease by 40%. And that is why we are interested in engaging this unidentified, unpaid workforce, formalizing them by training them to be Medicare certified home health aides so that they can engage to become a central player in the care team that's providing care for their loved one. In general, we're focused on this middle-class population. We do know that there's an upper income population that is primarily using private pay services. Certainly, if their family members is on Medicare, they're also eligible for the services that we're targeting. But right now, we're really focused on this missing middle population. What we hear from the families that we're engaging with, which I think everybody here knows, is that our older adult families who are chronically ill, who are facing difficulties as their health spans are not meeting their lifespans, these are people who want to age at home. And the family members who are caring for them as their financial resources are not sufficient to meet these needs really need the support of equitable compensation. And in general, from Medicare, we're not thinking about ways to compensate family caregivers. And yet we have this talented, committed workforce that is a solution that's already in place. And so why are we training family members to become Medicare certified home health aides? Because Medicare has a benefit called the Part B home health benefit. It is a part of the Medicare home health benefit. The Part B simply indicates which trust fund is paying for this benefit, but this is a benefit that is ongoing, that can be used to manage chronic care over the long term. It provides up to 35 hours a week of in-home health, and as long as the patient remains medically eligible, that benefit can continue for an indeterminate amount of time. When you have a family member acting as a certified home health aide, as a healthcare worker in the home, again, we really see these dramatic decreases in healthcare system utilization, which is at the same time saving the system money. Now, we also work with providers. And what are the providers facing? Providers are really plagued by these workforce shortages. The turnover rate for a home health aide in the United States is about 100% on an annual basis, and about 85% of that is happening in the first 90 days. With family caregivers, you don't see that level of turnover. You've got people who are experienced already in the home, are not surprised by this, and are committed to caring for their loved ones. The other challenge that providers, healthcare systems, home health agencies are facing is the burdensome regulatory and reporting requirements and the margin contraction associated with reporting to Medicare. These are the areas that RubyWell is tackling for all of our partners. We are developing, and we have already developed, an eligibility engine that helps us not only predict whether someone will be eligible for these Medicare benefits, but also can determine that they may be eligible for a long period of time, and then what that reimbursement rate looks like in the context of the provider. And then for the family member themselves, once they become certified as a home health aide, they can use our technology to actually deliver the supervised care plan that is in place as they deliver care to their loved one. Now, they may only be working for 5 or 6 hours a day paid, but they're in the home 24/7. And so this is allowing us to capture a large amount of data about the changing conditions of a loved one. We are able to understand the details in the delivery of care. We're able to track the caregiver, and then we're able to capture all of this information, turn it into the reporting workflows, particularly at the documentation level related to medical eligibility, that both the agency, the provider, and the physician need in order to continue to reauthorize the care for ongoing episodes. RubyWell gets paid as a vendor by the provider. The average reimbursement for this population is between $2,600 and $3,000 a month. As many of you know, an episode is 60 days, but the reimbursement is done on a monthly basis. We charge about $250 a month per seat, and we provide not only the access to the new revenue through the patient and the labor attached to that patient, but we also then help the agency themselves both reduce their overhead costs by about 40% and also at the same time really guarantee that they're able to be reimbursed for the care that they're providing. We currently partner with the Sandwich Club, who presented today, and we provide all of the content for the National Council on Aging and the Caregiver Action Network, specifically around how to manage your financial journey as an unpaid family caregiver. We are in market currently. We have very excitingly just partnered with a publicly traded national home health agency that operates nationwide, and we're beginning to go into market with them in 2 specific states. We also are operational in the state of Pennsylvania, where we have already put 4 family members have completed their training. We have 26 in training, and we have 175 in the pipeline, and we're placing those 4 family caregivers currently into home health agencies in the state of Pennsylvania. We have a team that really has a background in both healthcare and specifically Medicare. I like to think of Medicare as its own skill set, really understanding the rules-based environment and how to use technology to leverage better care, better outcomes, better satisfaction from the patients within this rule-based environment. And we're very thankful not only for the team members that we have, but for a very deep bench of advisors who actually act in many ways as employees on a day-to-day basis. Thank you so much for your time. We are raising a seed round. We're at the very tail end of our seed round, and we are really continuing to look for provider partners who are interested in targeting family members who are caring for a loved one with a chronic disease at home, who are interested in providing ongoing home health to that population. Thanks again.
Thank you, Julie. Next up, we have Nicole Cathcart, co-founder of Contently.
Hello, everyone. As Kate said, I'm Nicole Cathcart, co-founder of Contently, and I have with me Max Janisic, also co-founder of Contently. For Max and I, caregiving is personal. Like so many millions of Americans in this country, we have family members who've stepped up to care for loved ones. And as how we've helped them navigate their caregiving journeys, we found that it takes an incredible amount of time and effort to find the right advice, tools, resources, to support caregivers as the needs of their loved ones evolve over time. And we want to solve that with Contently. So it's no surprise to people here that caregivers are burning out. Why are they burning out? Well, the average caregiver is spending 26 hours a week providing care. 25% are spending over 41 hours a week caregiving. This is in addition to working, often also caring for children under 18. Additionally, the majority of caregivers don't know what resources are available to them, specifically local resources, but also more generally, what products and services are needed, not to mention advice around day-to-day challenges that could really help. And finally, the majority of caregivers have reported family conflicts over caregiving. And the caregivers that we've talked to have reiterated this, that within siblings especially, there can be considerable conflict around what to do next when situations arise because of the ambiguity over what might be the right decision for care. So our vision at Contently is to make aging in place and caregiving overall more personalized and more proactive. And we want to give caregivers access to an ecosystem of resources right at the time they need it, based on whatever challenge they're facing at that point. And that means everything from crowdsourced advice from peers to personalized care plans and what local resources might be available to them. So what does Contently look like today? Well, we are live in the iOS and Android app stores. Contently's experience really starts with the in-place score, which is a bit like a credit score for aging. The in-place score starts with an assessment where you answer questions about how your loved one is doing around activities of daily living, like shopping, eating, personal hygiene. And you also answer questions about your own burnout. We combine those together into a quantitative score that you can track over time. This is a great point or great discussion point for families to talk about changing needs, adding services, adding help, especially for that primary caregiver. We also have a community where we ask expert or experienced caregivers to share their advice, and other caregivers can add that advice to a to-try list. And as they are completing or trying those different ideas or pieces of advice, they can say how much time that advice saved them. And that's the foundation of our caregiving assistant, our AI assistant. Not only can it do things like emails, write emails for your siblings about how mom is doing, and answer questions about your Medicare benefits, Social Security benefits, but ultimately we're building a training resource with our community that can enhance that AI. And finally, our age-wise recommendation system is really the combination of these pieces together, which is when we see that your score in shopping or managing healthcare is dropping, then we can proactively send you recommendations based on peers, based on available services. So you don't even have to search for what might help in your situation. Max and I started working together over 10 years ago. We built products and a company for Cambia Health Solutions as part of their innovation team. And now Max is a two-time healthcare CEO, now the CEO of All Care Health. I've been in marketing for over 20 years and focus on on behavior change using digital experiences. And we are just getting started. We are just starting our go-to-market. We are looking for caregivers to participate in our platform and provide their advice and experience, advisors and experts to help us with our go-to-market, pilot partners, in particular Medicare plans who want to empower family caregivers, specifically because family caregivers and aging in place can help save plans up to $20,000 per year per member. And we're also looking for investors as we take our app and our product to the next level. Thank you so much for your time, and please feel free to get in touch with any questions.
Thanks, Nicole. Next up, we have Nikita Gupta, CEO and founder of Disco Tech Abilities.
So like Katie said, I am Nikita Gupta, the CEO and founder of Disco Tech Abilities. Our product is the Disco Diaper. And the Disco Diaper started with my sister, Nikki, who is a young adult. She's a year younger than me. She's 28. And she actually suffers from a genetic disorder, which leads her to have a cognitive ability of a 9-month-old baby. In this situation, as you can imagine, she's completely dependent on adult diapers. And this is something that both Nikki and my mother, who is Nikki's primary caregiver, deal with. This has also often led to Nikki being hospitalized due to poor incontinence products and care at no fault of the caregiver, but it just becomes so complicated that Nikki has suffered from sepsis due to incontinence issues. I considered this problem to not be a problem only of my family's, but also to be a problem that I'm sure millions of other Americans suffer from. And I was correct. There are approximately 25 million adults in the US who suffer from incontinence. And financially speaking, that costs about 400 million USD on just diapers alone. And that does not include all of the peripheral products that are used when you use adult diapers, such as underpads, etc. And not surprisingly, this is something that actually is very pertinent to women, as 80% of these incontinence adult diaper users are women. In the lifespan of a woman, if you think about it, from giving birth to post-pregnancy care to then menopause or heavy periods, it makes a lot of sense that 80% of diaper users are indeed women. So considering this, I know I had to recreate the adult diaper. I needed a diaper that had a lot of absorbency, that was leak-proof at night, as the biggest problem I noticed in the lifestyle of my sister and my mother was that Nikki would wake up often at night, in the middle of the night, like 2 o'clock, and it would take about 20 minutes for my mom to get her changed. And so that was a big issue in their nighttime sleep. I need to know that it had to be easy to change. The easier the diaper is to change, the less time it would take per change for any caregiver. And it has to be cost effective, as adult diapers are extremely expensive, and insurance reimbursement for diapers is very, very tricky. So I had to create a solution to this problem. I decided to introduce the disco diaper. We want to tackle all 4 of those issues. We want to make sure it has extra absorbency, it's leak-proof for nights, it's easy to change, and it's cost-effective. How did we make it easy to change? We introduced Velcro tabs, no more of those flimsy tabs that rip off easily. We also introduced back leakage and side leakage protection. So if you think about sleeping at night, whereas traditional diapers are designed for sitting up or standing up, when you lay down, the flow of urine changes. So a lot of people who may be familiar with perhaps somebody in their family that wears a diaper knows that the diaper that leaks at night, it'll leak from either the side or the back, or it'll be heavily based on the sleeping position of the individual wearing the diaper. In order to tackle this, we've introduced extra absorbency in the back and the sides of it, and we've made it easier to put on. How we've made it easier to put on is by introducing a concept to diapers that is peel and stick interchangeable pads. So we've created a diaper where the back sheet is reusable, and you can toss it in the washing machine in the morning, but the pads that go into the diaper, depending on wherever you experience the most leakage, can be reused. So at nighttime, instead of having to get up and spend 20 minutes changing the entire diaper, you can simply open the diaper from the sides and replace position of the Velcro tabs, remove the soiled portion, since the whole diaper is rarely soiled, and replace it with a fresh, clean, unsoiled pad, close the diaper, and go back to sleep. Of course, it wouldn't be the disco diaper if we didn't cater to different colors, different needs, such as different sleeping positions and different leakage positions, as well as introducing more underwear-like color or skin color type colors. I myself am experienced in medical device commercialization. I worked at UIC in the technology transfer office, where I worked on medical device commercializations. I also have experience at the Emory technology transfer office in medical device commercializations. I worked at Orasense as the chief scientific officer, where I worked on a neurological device for disability care as well. Discotech has participated in the M-Hub Women's Empower cohort, which is our first accelerator. And I would be nothing if it weren't for my team. So in our team, I'm so lucky to have Parth Brahmpot, who is our accelerator and fundraising expert. I have Abhilash Chaudhary, who is our Startup World experience and our lead R&D engineer as well. I have Dory Burkhart, who's our marketing manager. And of course, I have Nikki Gupta, who is the product testing intern for Discotech. We are currently seeking, we just started, so we're just seeking $300K for our initial funding. We believe this will be a good startup amount for our manufacturing. And we're also seeking manufacturing expertise from anyone. I would love to hear from everybody regarding this. Please see my email at the bottom. And thank you so much for your time.
Thank you, Nikita. And I'd like to thank all the startups for their participation in the program. Terrific presentations today. I'd also like to thank our partners, RRF Foundation for Aging, Samuels Foundation, and X50 for your partnership in the program. And thank you to our mentors, the workshop faculty, as well as the judges. Without you, this program would not be possible. So as Stephen mentioned earlier, all the teams presented longer pitches to the judges earlier this week to help select the winner of the program. And so we're thrilled to announce the winning solution, and the winner is RubyWell. Congratulations, RubyWell. To everybody here, please join us for the virtual networking session that will be starting now. So you can head over to the Zoom. And again, that link is found in the Zoom chat here, as well as sent to you on email. See you over there soon.